Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be covering cardiac disorders. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for Next Generation NCLEX review session, both a part one and a part two. Um, Every month, I offer the review session once. It's usually at the end of the month, so be sure to check out the calendar. But in part one, I teach you how to think critically. I teach you about the most important scenarios that NCLEX may provide to you and where your brain is supposed to go. I teach about prioritization. I teach about delegation. In part two, we actually go over NCLEX type questions and, more importantly, the rationale and how they should be applied when you're thinking about your answer choices. So you can check that out. If you're a current nursing student, I have something in store for you. Audio lessons. If you have to do really well on your next exam to pass, be sure to check out my audio lessons and see if I have something that matches your next exam. Maybe you want to pick my brain about something. You can sign up for a consultation session, or if you want that one-on-one time with me, you can sign up for a private tutoring session. There's so many resources available. Again, my website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, or right here on YouTube. My handle is the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Cardiac disorders. Okay, first question. So your patient with acute coronary syndrome displays a blood pressure of 160 over 95, heart rate 102, respirations 22, O2 sat 96% on room air. ECG shows STEMI. What is going to be your next nursing action? Administer aspirin 325 milligrams orally, position the patient in high Fowler's position, administer morphine 2 milligrams IV, or prepare for immediate cardiac catheterization. Wow. I did not think it was going to be this close. 23 of you guys chose the correct answer, but even more of you guys chose the wrong answer. So let's talk about this. And I understand what happened here. I'm going to address this so you guys do not make the same mistake on your exam. So the correct answer here, guys, is to administer morphine 2 milligrams IV. This patient has acute coronary syndrome. This is a sudden or acute decrease in blood flow through the coronary arteries. Guys, the coronary arteries, this is what supplies oxygen, vitamins, minerals, nutrients, right? To the heart muscle itself. Just like every other organ in your body needs to be perfused, well, so does your heart. Okay? With that being said, I just told you what acute coronary syndrome is. Patient with acute coronary syndrome, by the way, acute coronary syndrome, guys, this is a medical emergency. This is often, what's the word? This often comes right before a myocardial infarction. So it tells us this patient's having an acute, happening right now, acute coronary syndrome. We see the vitals, and then what does the ECG show? STEMI. What's the first thing we're going to do? We're going to give morphine. Why? Morphine's going to decrease the pain. It's going to decrease the demand for oxygen. We don't want the heart to work harder. We want it to work less. So the demand for oxygen will be decreased. Well, Professor D, when it comes to Maslow's hierarchy of needs, when it comes to prioritization, who cares about pain? Pain never killed anyone. Yeah, pain never killed anyone except for 5 situations. And guess what? MI is one of them. Look at what the ECG says. STEMI. Okay, so we're going to give that patient morphine. It's going to decrease. By the way, the 5 situations where pain actually is a priority, right? You're going to treat it as if physiological integrity as it is in risk, because it is myocardial infarction, what we're concerned about here, burns, stones, cancer, sickle cell crisis. The first thing we're going to do is give morphine, decrease pain, and also decrease the demand for oxygen on the heart so the heart doesn't have to work as hard. Now, 24 more of you guys chose the wrong answer, which is position the patient in high Fowler's position. I understand if the question said that the patient's having difficulty breathing, they're having shortness of breath, they're having dyspnea, then absolutely, you're going to sit them up. It's fast, it's effective, it's non-invasive, right? That's a great thing to do. But what about this situation tells you that the patient can't breathe? In this situation, they tell you what the problem is. First of all, they give you a clue. They tell you the patient has acute coronary syndrome. Medical emergency, you hear acute coronary syndrome, you better say, uh-oh, what's next? MI, right? And then they give you some vitals, and then the how do you guys say the Americans? The cherry on top, right, is ECG shows STEMI. Morphine. All right, let's keep going, guys. All right, guys. Which teaching about the management of atherosclerosis progression would you prioritize? Here are the options. Avoid exercise to prevent exacerbation of symptoms. Encourage smoking cessation and a healthy heart diet, recommend the patient increase salt intake to improve blood pressure control, or suggest the patient reduce fluid intake to lower blood pressure. What do you guys think the answer is? Very good. Encourage smoking cessation and heart healthy diet. So let's talk about atherosclerosis, guys. This is where the vessel, guys, the lumen, the inside of the vessel basically gets clogged. It gets obstructed by things we don't want there, like plaque, fat, um, other foreign entities, things we don't want there that will cause decreased blood flow. Remember, what's in the blood? Oxygen, vitamins, minerals, nutrients, right? All of this is so important that the tissues need. Okay, so that's what atherosclerosis is. Whenever you see that word progression, I want you to think get worse over time. Whenever there's progression, that means as time goes on, it only gets worse. What are you going to teach them? Stop smoking. You guys know stop smoking is for everything, right? But let's talk about it. Why are we choosing stop smoking? Number one, smoking causes vasoconstriction. With vasoconstriction, we're going to have less oxygen, vitamins, mineral, nutrients that's carried in the blood going to the tissues. That's number one. Number two, smoking speeds up the process of plaque buildup, and that plaque sticking to the vessels. And here's why. Smoking damages the vessels. And so with more damage to vessels, you're going to have more plaque and fat and all that crap that you don't want sticking to those damaged parts of the vessel. So smoking is bad, bad, bad. So you're going to teach the patient to stop smoking. And of course, heart healthy diet. What do I mean when I say heart healthy diet? I mean, decrease fats, decrease foods with lots of oils. You know, those foods that are labeled as rich fat, okay, greasy. We want to stay away from foods that have lots of salt, because what's follows salt? Fluid. All that fluid causes what? The blood pressure to go up, right? What are you going to encourage? Foods high in fiber. Why? Because fiber takes all that crap that's in the lumen as it's going through. It pulls all that crap with it. So when you go having low bowel movement, it all comes out, right? It helps pull it all out. So you want foods high in fiber, but low in fat, low in sodium. You want your HDL to be high and your LDL to be low. Let's look at the other options. Avoid exercise to prevent exacerbation of symptoms. No, we're going to encourage the patient to exercise. That's good for their health. Recommend the patient increases salt to improve the blood pressure control. Absolutely not. The opposite, lower salt. And suggest patient reduce fluid intake to lower I can't speak, to lower blood pressure. No, we want the patient to stay hydrated. We want them drinking lots of fluid. So the correct answer, which most of you guys chose, was encourage smoking cessation and heart healthy diet. Next, select all that applies. Which of the following is the most appropriate nursing intervention for a patient with pericarditis? Here's our options. Administering high flow oxygen, encouraging the patient to lie flat, administering prescribed NSAIDs, or preparing the patient for immediate pericardiocentesis. What do you think is going to be the most important nursing intervention for that patient with pericarditis? Huh. Only 40 of you guys chose the correct answer, which is administering prescribed NSAIDs. So let's talk about this, guys. What is pericarditis? This is inflammation of the pericardium. NSAIDs is our number one first line treatment for this. Almost left. For this. Okay. When you see something end in itis, thank you. Very good, Lalo Bell. When it ends in itis, means what? Inflammation. NSAIDs, non-steroidal, anti-what? Inflammatory drugs. Okay, that is our first line treatment. You need to know that when it comes to pericarditis. The first one, 45 of you guys chose administer high flow oxygen. High flow oxygen isn't necessary. And between those two, you're going to go with the NSAIDs, right? Because we're going directly to the problem. Next, encouraging the patient to lie flat. I'm happy only 11 of you guys chose that. Absolutely not. The patient will be sitting up semi-Fowler's position. And last, preparing the patient for immediate pericardiocentesis. Patient may need a pericardiocentesis, but that would be if the case was very severe. And there's nothing in this question that tells us the patient's having severe pericarditis. So, okay, so with simply what you're seeing here, we expect to give NSAIDs. Now, if those NSAIDs aren't working and the patients develop complications, they've gotten worse, then eventually, yeah, we may have to do a pericardiocentesis, but that's not what we're going to run to. Whenever you guys have a multiple choice and you have to choose only one, here's a hint, guys, go for the least invasive, most effective measure. That's usually going to be your best answer, okay? That's usually going to be the correct answer. All right, your patient with aortic stenosis exhibits a systolic murmur, a weak pulse, and hypotension. What would be your priority nursing intervention? Is it encourage the patient to increase physical activity? Is it to administer a diuretic as ordered? Is it to assess for signs of heart failure and notify the healthcare provider? Or would it be to prepare the patient for immediate surgery? Take a look at those symptoms. What do you think you're going to do? Very good. You're going to assess that patient for signs of heart failure, and you're going to notify the healthcare provider of your findings to get orders. Let's talk about this aortic stenosis, guys. So this is a narrowing of the aortic valve, and so it decreases blood coming from the left ventricle to the aorta, right? We're going to be assessing this patient for other symptoms of heart failure, and you have to notify the healthcare provider immediately. Not encourage a patient to increase physical. So let me get this right. You're assessing your patient, and they're exhibiting a systolic murmur, a weak pulse, and hypotension. There's something actively going on with them right now, and your bright idea is to increase the oxygen demand on the heart. What kind of sense does that make? Because if you're having the patient exercise or you're having them ambulate, what you're really doing is increasing the demand for oxygen, which is making the heart work harder. That makes absolutely no sense. If you choose that, you're a killer. I'm sorry. All right. And we're not in the business of killing our patients. Next, 5 of you guys chose to administer a diuretic as ordered. So you're not even going to assess your patient for what you should be looking out for, which is that heart failure. You're just going to give a diuretic? Absolutely not. Remember your nursing process. And then last, only 2 of you guys chose that, so good job. Prepare the patient for immediate surgery. Are you kidding me? You don't even know what's going on with your patient because you have it assessed further, but you're going to prepare them for surgery? on whose orders, because you haven't even called the healthcare provider to tell them what's going on for them to even say, okay, yeah, I think this patient needs surgery, because that's not your scope of practice, right? Okay, let's keep it moving. All right, put this in order. You're preparing your patient to undergo an exercise stress test. What are going to be your directions to this patient? Take your mouse and put your directions in order. What are you going to say to the patient? The code to get it is 143782. 143782. Wow, only 6 people got this correct. Okay, let's talk about it. The first thing you're going to do, you're going to explain the procedure to the patient and assess for any contraindications. Why are we doing that first? Because guess what? If there are contraindications, nothing else matters, because we're not going through with the test, right? So the first thing you're going to do is explain the procedure. Remember, this is not invasive. If the patient was having surgery, it was invasive. You as the RN would not be explaining this. You as the LPN would not be explaining this. That's the job of the surgeon, right? Your job would just be to witness consent. But this is not an invasive procedure that we're talking about. So you're going to explain the procedure to the patient, and you're going to assess for any contraindications to the test, like if they've had a recent MI, if they have severe cardiac dysrhythmias, severe aortic stenosis, things like that. If they have any of those contraindications, nothing else matters, because we're not going to go through with the test anymore. Or at least we're going to call the healthcare provider and let them know, and they made that decision, right? Next, after you've done that, you're going to monitor the patient's vitals. You need a baseline. Duh. You need something to compare, right? And you're going to take your patient's O2 sat. After that, you're going to instruct the patient to begin walking on the treadmill gradually, or if they're using a bike, start cycling on the bike gradually. So slowly they'll increase the pace. And then last, stop immediately. You're going to teach them to stop immediately if they have any symptoms like chest pain, dizziness, shortness of breath, etc. Why is this last? Guys, teaching is always last. We don't teach until we know our patient's stable. In this scenario, we're not going to be teaching about when to stop until we actually know that this is even happening, right? So we have to assess them for contraindications. We got to take their vital signs. We're going to teach them how to perform this stress test, and also when to stop before it even begins. Okay? You note your patient has an ejection fracture of 35%. What's going to be your priority nursing intervention? Is it going to be encourage the patient to increase physical activity, monitor the patient closely for signs and symptoms of heart failure, administer anticoagulants to prevent blood clots, or instruct the patient to increase fluids? What do you guys think? Very good. You're going to monitor the patient closely for signs and symptoms of heart failure. Why? Why are we concerned about that patient going into heart failure? Well, ejection fraction is 35%, normal's around 55 to 70%. Now, ejection fracture, so that's a percentage of the blood, of the fluid that's being pumped out through the heart chamber. Okay? And remember, it's normal is 55 to 70%, so 35, it's much lower. We're concerned about that heart actually failing to do its job, which is to pump out blood to the body, oxygenate blood to the tissues. Okay? 3 still chose encourage the patient to increase physical activity. Guys, if you don't listen to anything else I say on this live, or this video, please listen to this. If the heart is in trouble, actively, right? Right now, the heart is in trouble. We want to decrease oxygen demand. Okay. Next, administer anti coag. Now, let me go back to the physical activity later, because physical activity is good for the body. That's something that we can teach the patient to do later, but we have to address what's happening right now to the patient. So you always have to think to yourself, if I can do one thing for my patient right now, what can it be? Next, administer anticoagulants to prevent blood clots. That would be more appropriate for a patient who is going through something like AFib. And last, instruct the patient to increase fluids. Here's the thing. I just told you that we're concerned about that patient going into heart failure, that heart not being able to pump out enough oxygenated blood to the rest of the body. So if it's not pumping out that fluid, what's that fluid doing? It's backing up, it's backing up, it's back. Do you think this type of patient needs more fluid? Right? So if anything, we're going to be watching the fluids on this patient, right? We're not going to tell them to increase fluids. Very good. Your patient's prescribed digoxin or cardiac glycoside. What would make you hold the drug and call the healthcare provider? Would it be an apical pulse of 58 beats per minute, a serum potassium level of 4.2, blood pressure of 120/80, or reports of mild nausea and fatigue? So you're about to give glycoside. What would make you not give that medication and immediately call the healthcare provider? Very good. Apical pulse of 58 beats per minute. Now, we love digoxin. That is our go-to drug for heart failure. We love it. It increases the contractility of the heart. Wonderful. However, a side effect is it decreasing the heart rate. So imagine you're about to give this medication and you take that patient's pulse and that pulse is less than 60. Are you the nurse that actually wants to keep their license? Are you going to administer that drug just because it was ordered? Absolutely not. You're not a robot, right? You think critically. And so you understand if that patient's heart rate is less than 60 and then you give this drug, you're going to make it even worse. So you're going to not give that drug and then you're going to call the healthcare provider. Very good. Okay. Which drug class is not used in heart failure to reduce afterload? So which drug that's used in heart failure is not used to reduce afterload? Only 16 of you guys chose the correct answer. Okay, let's talk about this. ACE inhibitors, ARBs, arterial vasodilators, they reduce the afterload, but diuretics, they reduce the preload, guys. You guys have to know this. It's very likely you're going to get this as a test question. You guys have to know this, okay? Preload, that's how much blood or fluid that's already in the ventricles that's ready to be pushed out. Okay. Now, afterload, that's the pressure against which your heart has to pump out that fluid. You got to know the difference between preload and afterload, and you have to know which drugs reduce preload versus afterload. Don't shoot the messenger. I'm just trying to help you guys. All right, next question. It applies. You're providing teaching about risk factors for coronary artery disease. Which are modifiable risk factors? Select all that apply. So you need to select all of the modifiable risk factors for coronary artery disease. Hypertension, age, smoking, hyperlipidemia, family history, physical inactivity. So while you guys are choosing, let me talk to you about coronary artery disease. That is the narrowing or blocking of the coronary artery, okay? And it's either narrowed or blocked due to plaque buildup, fats, cholesterol, all that horrible stuff we don't want, clogging that vessel. Look at this picture. Look at what's happening, right? All of this, you see where my mouse is? That's plaque and fat and cholesterol narrowing the way for the beautiful RBCs to go through, right? So we're talking about modifiable risk factors. Modifiable risk factors are things that you can change to improve, that can be improved through either lifestyle modifications, right? Non-modifiable risk factors are things you have no power over, you cannot change through lifestyle modification. So we're looking for modifiable risk factors, things that you can change. First, hypertension. You don't have to be hypertensive. You can change that. And when I say change, I don't mean resolve it, but you can improve it at least. How can you improve it at least? Exercise, appropriate diet, decreasing stress, right? That is a modifiable risk factor. Next, smoking. You don't have to smoke. Remember, smoking causes vasoconstriction, increases the process of atherosclerosis. It damages vessels. So you don't have to smoke. That is modifiable. Hyperlipidemia, that is modifiable. How can you improve that? By eating less foods that are high in fat, less French fries, less burgers, less pizza, less all that stuff that I love to eat. Moving on. Physical inactivity, that is modifiable. How can you modify that? By getting up and exercising, right? Now, non-modifiable risk factors, these are risk factors that you cannot change. These are risk factors that contribute towards coronary artery disease. It puts you at risk, but there's really nothing you can do to change it. Your age. Unfortunately, the older that you get, the higher at risk you are for coronary artery disease. Those vessels get weaker, right? They're hardened. And you got to think about it. The longer that you are on this earth, the more time you have to eat all the crap that you're not supposed to be eating because they're clogging up your arteries, right? That's just what it is. So you can't change your age. Next, family history, genetics. Genetics plays a very big role. You can't change that. Okay? Last question, select all that applies. Which of the following interventions are appropriate for the patient diagnosed with pulmonary embolism? Select all that apply. Okay, here are your options. Administer oxygen, encourage the patient to ambulate, monitor vital signs, administer IV fluids and anticoagulants, elevate the patient's legs, place the patient in high Fowler's position. Again, administer oxygen to maintain O2 levels above 90. Encourage patient to ambulate frequently to prevent further clots. Monitor patient's vital signs, especially for changes in blood pressure and heart rate. Administer IV fluids and anticoagulants as ordered. Elevate the patient's legs to promote venous return. Place the patient in high Fowler's position to improve ventilation. On the live, I saw a lot of you say all of them. No. Let's go over these. The first one, administer oxygen to maintain O2 sat level above 90. Yes. So before we even get into the answers, actually, let's go back to the question. Let's talk about pulmonary embolism. So we have a clot or a foreign body that's lodged itself where? Most likely in the pulmonary artery, right? So we're concerned about airway respirations. So yes, we're going to give oxygen. We want to keep that O2 sat above 90. Preferably, we want it between 95 and 100. But at least above 90, we don't want that patient going into respiratory distress. Next option, encourage a patient to ambulate frequently to prevent further clots. I'm happy only 39 of you guys chose that. You're starting to get it. When something's actively happening to the patient, we don't want the heart to work harder. We don't want to increase oxygen demand. We're not going to have them walking around. Plus, we don't want to dislodge a clot. So no, we're going to rest the patient. Very good. Next, monitor patients' vital signs, especially for changes in blood pressure and heart rate. Absolutely. You always want to assess, get more information. Perfect. Next, administer IV fluids and anticoagulants as ordered. Yes, we want to prevent further clot formation. We don't want the patient to develop complications or for their condition to become even worse. Next, elevate the patient's legs to promote venous return. No, this would be appropriate for a patient that has a condition such as venous insufficiency, right? But we're talking about PE. So no, we're not going to do that. It's not necessary. And then last, place the patient in high Fowler's position to improve ventilation. Listen, whenever there's a problem with breathing, you always want them sitting up. Okay. Why? We want to decrease the pressure on the diaphragm. We want the lungs to be able to expand. We want to improve oxygenation, right? Any problems with breathing, we're always going to sit them up. So that is true. And guys, that is the end of cardiac disorders. There's so many more that I can go over. If you guys would like to see a part 2, please be sure to let me know in the comment section of this video. If you guys are on the live, just let me know on the live if you'd like to see a part 2 Kahoot on cardiac disorders, or if there's something else that you'd like to see me cover. Let's see how you guys did.